Skin tags and warts on your neck, armpits, back, those small lesions that bother us so much aesthetically and sometimes even worry us. Can they really disappear with something you do at home? The short answer is yes. The honest answer is that the real solution is much simpler and safer than what the internet wants you to believe. I'm Dr. Fernando Manocci, and after more than 20 years as a physician, if there's something I've seen over and over, it's the frustration in the eyes of my patients, especially in older adults who come to my office tired of fighting these little marks on their skin. They've tried everything, spent money on remedies that don't work, and in the worst cases, put their health at risk with quite dangerous methods. Today, I'm going to reveal the exact method I share with them. It's not a magic solution or an empty promise. We're not going to talk about dangerous home remedies that can leave you with a scar or an infection. It's a very simple step-by-step process, explained in a practical and safe way, so you understand what you really have on your skin, why it appears, and how to say goodbye. So if you're ready to stop hiding your neck or armpits and want to regain the peace of mind of having healthy skin, stay with me. Because the information I'm going to share today won't just give you a solution, it will give you knowledge and power over your own health. What you have, is it really a wart? Before running off to find a solution, the first step, the most important of all, is to pause and ask ourselves, is this thing on my skin really a wart? In my experience, a huge majority of patients who come to my office worried about warts actually have something completely different, and this confusion is the root of failures. Let's bring some order to this. Your skin speaks to us, but we need to learn to interpret its language. There are mainly two types of lesions that people confuse all the time. Let's start with real warts. A wart is basically the result of an infection. The culprit is a very common virus called human papillomavirus, or HPV. There are more than 200 types of this virus, and most are harmless and only cause these lesions. Probably all of us have been exposed to it at some point. It's transmitted through direct contact, skin to skin, or through surfaces like the floor of a public shower or a shared towel. The virus is an opportunist. It takes advantage of small cuts or scratches to enter the most superficial layer of the skin. Once inside, it gives an order to our cells to multiply. And that uncontrolled multiplication is what forms the lesion we call a wart. How do you recognize a common wart? They're usually firm, hard, and rough to the touch, like a small cauliflower. If you look very closely, sometimes you see small black dots inside. Many people believe these are roots, but they're actually small coagulated blood vessels. They appear mainly on hands and fingers, but also on knees or on the soles of feet, where we call them plantar warts, and they can hurt when walking. And here's the key word. Warts, being viral, are contagious. They can spread to other parts of your body or be passed to other people. Now let's move to the star of most confusions, the acrocordon. These are the famous skin tags that appear frequently on the neck, armpits, or groin. They affect a huge percentage of the population, almost half of adults over 50 years old. And here comes the fundamental difference. Acrocordons are not caused by a virus. I repeat, they have nothing to do with HPV. Therefore, they are not contagious. You can't pass them to anyone, and nobody passed them to you. An acrocordon is simply a small benign growth of your own skin. It's made of collagen fibers and blood vessels trapped in a layer of skin. Visually, they're also different. Unlike the wart, which is hard and rough, the acrocordon is usually soft and moves. It hangs from the skin with a small stalk, as if it were a little sac. So why do they appear? Science points to several factors. The first is obvious: friction. It's no coincidence they appear in folds, where skin rubs against itself or clothing. But there's a much more revealing internal factor. The massive appearance of acrocordons is strongly related to our metabolic state, specifically to insulin resistance. Insulin is like a key, allowing blood sugar to enter cells for energy. When we eat a lot of sugars and refined flours, our cells can become deaf to insulin's signal. To compensate, the pancreas produces more and more insulin. Insulin is also a growth-promoting hormone. High levels can give skin cells the order to multiply. So in many cases, those little flesh balls aren't just an aesthetic problem. They're a small warning signal that your skin is sending you about your internal health. To finish, there are two other lesions. One is seborrheic keratosis, the misnamed age warts. They're usually brown spots with a waxy appearance. They're not dangerous. The other is the mole or nevus. If a lifelong mole starts to change shape, color, size, or if a new one appears that bleeds or itches, that should never be ignored. It's a signal to consult a dermatologist without hesitation. Summarizing: hard, rough on hands, viral wart; soft, hanging on neck, reverse acrocordon. Now that we know the difference, we can understand why so many home remedies fail, and worse yet, why they can be a risk. Methods you should never try. The most popular for acrocordons is tying them with a thread. The logic seems simple: cut off blood supply so it dries up. But the reality is very different. The first big risk is infection. You're strangling living tissue and creating a wound. Bacteria can invade and cause cellulitis, an infection that causes pain and swelling. The second risk is bleeding and scarring. If it falls off, it can cause bleeding that's difficult to stop. That necrosis isn't clean, leaving a scar worse than the lesion. The third risk, the most serious, diagnostic error. Are you 100% sure what you're tying? If you remove it at home, you lose the opportunity for a doctor to analyze it. The second group is trying to cut the lesion at home with scissors or blades. Here the risks skyrocket. The danger of hemorrhage and infection is enormous. The third method, uncontrolled acids like apple cider vinegar or lemon juice. These acids burn both the lesion and healthy skin, causing chemical burns. I know the temptation is enormous, but my duty as a doctor is to put your safety first. An infection or a scar is too high a price for saving a consultation. The right path is not the fastest, it's the safest. The method that does work consists of 3 steps: identification, controlled action, and recognition of limits. Step 1. Safe identification at home. Ask yourself key questions. Where is it? What shape? What color? Has it changed? Do you have any medical condition? If it's soft, hangs from a stalk, and is skin color, it suggests an acrocordon. If it's hard, flat, and has black dots, it points to a common wart. Step 2. Controlled action. The safest method to treat common warts at home is low-concentration salicylic acid. It's sold over the counter at pharmacies. Soak in warm water for 5 minutes. Dry well, file gently with a disposable file. Protect healthy skin with petroleum jelly before applying the acid. Cover it. Repeat this process every night. Consistency is what gives results. If the surrounding skin gets red, suspend treatment for a couple of days. For acrocordons, the real secret is internal management. Adjust your lifestyle to improve insulin sensitivity, drastically reduce sugars and refined flours. Move more. Exercise helps your muscles use sugar. This approach won't make acrocordons fall off tomorrow, but it's the strategy to stop new ones. Step 3. Recognition of limits. Consult a professional if the lesion is on the face, genitals, if it bleeds, hurts, or changes rapidly. Prudence is the secret. The true beauty of skin is not in perfection, but in its health. Health is built with informed decisions and patience. Know your skin, act with prudence. Subscribe and activate notifications. Every week I share practical tips based on science. Leave me a comment below. Your experiences enrich us all. Thank you for joining me. Take good care of yourself. Take care of your skin. The best decision in health is an informed decision. Until next time. Let's go deeper into why these lesions appearing in folds matter so much. Friction is not just physical, it's a constant stress on the skin cells. This constant friction creates a state of microinflammation. For patients with insulin resistance, this inflammation is like fuel for cell multiplication. Remember, these little sacs are made of your own collagen. It's your skin trying to protect itself or reacting to internal growth signals. It's not an intruder. Good hygiene is essential, but scrubbing these lesions hard won't make them go away. In fact, aggressive scrubbing can irritate them and lead to pain. Many people believe that because it's natural, like vinegar, it's safe, but natural doesn't mean neutral. Acetic acid can be very aggressive for healthy tissue. The result is often post-inflammatory hyperpigmentation, a dark spot that can be harder to remove than the skin tag itself. Avoid these shortcuts. Every time you consume a high amount of refined sugar, you're sending a growth signal to these lesions. Reducing sugar is the most powerful prevention. Keeping your glucose levels stable prevents those insulin spikes. Stable insulin means your skin cells receive fewer growth orders. It's biology in action. Health changes don't happen overnight. It takes time for the body to rebalance. Be patient with your metabolic process as you adjust your habits. Lesions on the eyelids are particularly delicate. Never try anything at home near your eyes. The risk to your vision is far too high. Consult an expert. The same applies to the genital area. Warts here are often different types of HPV and require specific medical treatments to avoid complications. Modern dermatologists use cryotherapy, laser, or cauterization. These are fast, precise methods that minimize scarring and maximize safety. A professional procedure takes minutes and solves the problem permanently. Trying to fix it yourself often leads to more medical costs later. Monitoring is key. If you see a lesion changing color or shape over weeks, document it and show it to your doctor. Early detection is everything. Don't let fear paralyze you. Most skin tags and common warts are benign, but knowing exactly what they are gives you the peace of mind you deserve. A strong immune system helps fight the HPV virus. Vitamin-rich diets and moderate sun exposure contribute to your overall skin defense mechanisms. Keep your skin hydrated. A healthy skin barrier is less susceptible to micro-injuries where viruses can enter. Drink enough water daily. Wear breathable fabrics. Reducing sweat and friction in fold areas can help prevent the irritation that triggers skin tag growth. Cotton is your friend. Let's recap. Identification first. No dangerous home tools. Metabolic health is the long-term solution. Professional help for delicate areas. Building a relationship with your dermatologist is the best investment for your health. They are your allies in keeping your skin safe and beautiful. Your health is in your hands. Thank you for taking this time to learn. Share this with someone who might be struggling with these skin issues. I've seen patients who felt ashamed to wear short sleeves because of armpit skin tags. After a simple procedure, their confidence returned immediately. Confidence is about feeling free in your own body. Don't let small, treatable skin marks dictate what you wear or how you feel about yourself. There is also a genetic component. If your parents had many skin tags, you're more likely to develop them. But metabolism is still the factor you can control. While you can't change your genes, you can change your environment and diet. Science shows that lifestyle often overrides genetic predisposition. Some ask about tea tree oil or castor oil. While they have antimicrobial properties, they are rarely effective at dissolving an established acrocordon. Using them can sometimes cause contact dermatitis or allergic reactions. Always patch test any natural remedy on a small area of healthy skin first. I once had a patient who thought he had a skin tag, but it was a small basal cell carcinoma. This is why professional eyes are irreplaceable. Dermatoscopy allows us to see structures invisible to the naked eye. It's the difference between a guess and a certain diagnosis. Your life is worth that certainty. Common warts are very frequent in children because their immune systems are still learning. Most disappear on their own within 2 years. In kids, we often take a wait-and-see approach unless the wart is painful or spreading rapidly. Their bodies are amazing at fighting these viruses over time. It's also very common to see more skin tags during pregnancy due to hormonal changes and increased friction. Most don't require treatment until after delivery. During this beautiful stage, your body is undergoing massive shifts. Focus on your health and nutrition. The skin issues can be addressed later with your doctor. Insulin resistance isn't just about skin, it's a systemic state. Improving it benefits your heart, your brain, and your energy levels throughout the day. When your metabolism works well, you feel the difference. Your skin is just the most visible part of a healthy, functioning internal machine. Some find success with intermittent fasting or low-carb diets to reset their insulin sensitivity. Always consult a nutritionist before making big changes. Personalized nutrition is the key. What works for one person might be different for you. Listen to your body and follow expert guidance. Stress increases cortisol, which in turn can raise blood sugar and insulin. Managing your stress is also a form of skincare. Take time to breathe. Finding a few minutes of peace each day lowers your stress hormones. Your skin and your metabolism will thank you for those moments of calm. During sleep, your body repairs tissues and regulates hormones. Poor sleep is directly linked to increased insulin resistance. Make rest a priority. A consistent sleep schedule stabilizes your biological clock. This hormonal balance is reflected in the health and appearance of your skin over time. We live in an age of information overload. Choosing science-based knowledge is the most protective act you can do for yourself and your family. By sharing this video, you're helping spread safety and health. Let's drown out the dangerous myths with facts and professional medical advice. Your skin tells the story of your life. Treat it with the respect and care it deserves. Every small positive habit adds up to a healthier future. From childhood to old age, our skin protects us. It's our duty to protect it back from infections, injuries, and dangerous home experiments. Make the commitment today to listen to your skin's signals. If you see something that worries you, reach out to a professional. You're not alone in this. A healthier life starts with understanding. I'm honored to be part of your journey toward better health and better skin. Stay informed, stay safe. I look forward to seeing you in the next video. Keep those comments coming. I love reading your questions. Until next time, take care.